Good morning, lovely people. I'm so happy to be here. Take a big breath. This is sort of happening. And I'm very happy to talk about pediatrics. And in order to talk about this, I thought to explain what's happening today in 2023, let's go back in time to 1985. Half of you were too young, of course, to remember that, but those who don't, this is Back to the Future. This is the Goonies. This is all the groovy movies. And in 1985, there was a little baby born by the name of Jeffrey Lawson. Jeffrey was born prematurely on the east coast of the United States, and he unfortunately had a heart defect. So he actually needed to grow a pound or two to be old enough to have the surgery. And then he was transferred to the largest children's hospital in Washington, D.C. And he actually underwent heart surgery. In 1985, that was a big deal. Jeffrey needed to be cut open all the way from here to there. They had to open his ribs. They had to operate on the heart, and they closed it up again. Unfortunately, Jeffrey died a few days later. His mother, Jill, was, of course, grief-struck. She didn't know what to do, and she met with her friends, and one of her friends was a nurse, and she said, "I'm worried. I think that Jeffrey did not get any pain medications." And she said, "What?" So she ran back to the hospital. She looked through the charts, and in fact, Jeffrey did not receive any pain medications during the surgery. In fact, he did not receive any anesthesia. He was fully awake when he had the surgery. So, of course, Jill went to the leadership of the hospital. She went to the head of anesthesia and said, how did you do this? How could you possibly operate on my child fully awake without anesthesia and without any pain medication? And she was basically got a version of, "Woman, calm down. This is how we think today." In 1985, it was standard of care in the United States to operate on babies fully awake, without any anesthesia, without any analgesia. So we've gotten better. A little bit. This is not happening anymore in the surgery room, but we will talk about what's happening afterwards. And a lot of the clinicians you're dealing with were either around in 1985 or they were trained by people in 1985. And this explains a lot what's happening. So this is an End Well conference. My wife and I have 3 children who actually asked me, "Do we have to get a selfie with Yvette?" So I will send them this afterwards. And I had breakfast with them. They're in middle school, then high school, and I hope they're going to do something useful. Hopefully they go to college or become a plumber or an actor or a painter. I hope that they will be happy, and I hope that my wife and myself will die before my children. This very moment, there are 375,000 families in the United States who do not have this privilege. 375,000 families looking at that child, and they are worried that this child may die in a day, in a week, in a month, in a year, 10 years from now. In other words, there are more than 560 Boeing 747s cruising American airspace this very moment, full of children. Every 5 days, one Boeing 747 full of children crashes over American airspace. Children with life-limiting diseases. I assume, I flew in yesterday, you would not choose an airline which loses a Boeing 747 every 5 days, right? That airline is called the American healthcare system. Because what I need to do as a specialist for pediatric pain, palliative care, and integrative medicine, what we need to do as our interdisciplinary team of nurses, social workers, psychologists, doctors, nurse practitioners, we need to look the families in the eyes and they say, I promise you I promise you, when the worst happening in your life, if your child is entering end of life, I promise you that your child will not die in pain. I promise you that your child will not live with breathlessness or nausea, vomiting. I promise you that we take care of you and the healthy siblings. This promise is not happening in 2023. Most hospitals have some placebo, like 1, 2 sort of clinicians, very sort of small service. 90% of children in 2023 die without ever having seen anyone like a specialist like myself or the interdisciplinary team. So we need to do better. I remember a few months ago I was invited to meet Sophia, who was critically ill. She was on the intensive care unit. She had a severe heart defect. And I introduced myself to her mum and I said, like, how can I help you? I asked her, tell me about Sophia on a good day. And she told me about her. She showed me pictures and movies and what to do to a slide. And she also told me she hasn't really had a good day in a long time. And then I basically asked about her understanding, what's going on. And then I asked the single most important question in palliative care. So, considering what Sophia is up against, what are you hoping for? What are you hoping for? And she said, I hope for a miracle. I hope for a cure. I hope that I as a parent am not failing, that I have not left a stone unturned to take care of my daughter. And I said, you're an amazing parent. And I hope this too. I have 3 children. I have no idea what you and your husband are going through. Is there anything else you're hoping for? Just in case the miracle cannot happen, the cure will not happen. Is there anything else happening? She said, yes, I want to make sure that she's not suffering. I want to make sure that she's not suffering. And then she looked at me, I wish I could hold my daughter one more time. So I looked at the nurse and said, how long would this take us? She had like tubes and stuff and everything. She said, I don't know, 5 minutes? She lied. It was like 5 minutes, 30 seconds, right? But we got this going. Yeah. 6 minutes later, this mother, for the first time in many weeks, was able to hold her daughter. So then we, as our interdisciplinary team, were able to meet the family to improve pain and symptom management with drugs, good medications, and with hypnosis, something I'm trained in, biofeedback, aromatherapy, acupuncture, acupressure. Because that's what we do as an interdisciplinary pain, palliative, and integrative medicine system. And then we started taking care of the family, of the siblings. And about 3.5 weeks later, Sophia was able to comfortably die in her family's arms. This is what we call end well. That's what we need to do. So I have the privilege to sit in front of Elisa Stad, who funded our Stad Center at the UCSF Benioff Children's Hospital to combine pediatric pain, palliative care, integrative medicine, because we need to have this at every single children's hospital, not only we need this today, not only in San Francisco and Oakland, we need this in every single children's hospital in North America, in every single children's hospital in the world. All right, changing tack. How many of you have children? Okay, how many of you know a child? How many of you have been a child? Okay, so you're my audience. If I go to your city right now and ask every single child, what are you most afraid of seeing the doctor right now? What is he or she going to say? Needles. That is the number one thing kids were suffering from. We have published this, there's research. Even children with serious illness after bone marrow transplant, after heart surgery, like what was the worst thing? It's the needle pain. So we were actually able to start with something what we call a comfort promise. We can pretty much promise to completely take away the pain and the anxiety caused by needles. Vaccination, blood draws, all that thing, yeah? You need to have those pokes, those jabs, ouchless. How do we do that? Well, I'll show you stuff in a second. Yeah, we need to put numbing cream on. We need to make stop. We need to have to stop holding kids down. We need to use distraction. We want for babies or infants to be breastfed or giving them sugar water at the time. This is not rocket science, yeah, or rocket surgery, as Joe Tribbiani would call it. Yeah, this is very straightforward, and we have shown this to be effective. So recently, I was helping to implement this in 4 countries of low-income countries in South America, in Sub-Saharan Africa, and in Southeast Asia. What I didn't know is that most children in those countries die of cancer. More than 80% survive here in the United States. So what's the difference? The difference is, of course, that they have much more advanced cancer when they come to the hospital. The difference is that the parents may live in poverty 800 miles away, so they're not doing this. But one of the top reasons why children stop cancer treatment in low to medium income countries is because they're afraid of needles. Just 2 weeks ago, I was at the biggest pediatric cancer conference, and I spoke to many parents. We were like at a forum like this, and we said, like, coming into the hospital, because there are no central lines. Every time the child has to be poked, you draw blood, then it has to be held down to get some IV access, then you start the chemotherapy, then this vein goes bad. At 3 o'clock in the morning, the medical student tries 17 times again to get this in. This is so bad that many children and many parents decide not to continue this, not to continue the treatment. Even here in the United States, many people forgo medical care because they're afraid of needles. I'm not going to ask, we know 1 out of 4 is super afraid of needles. So we have hundreds in the audience who don't like this. So I invite you to join me. I invite you to join me on the Ouchless Jab Challenge. We need to make sure that we can promise for every child, every time, everywhere, that we will do the bloody best to prevent pain and anxiety caused by needles. Because this, today, in 2023, is the biggest healthcare problem for children in North America and in the world. If we wait for the healthcare system to change this, we're going to talk in 50 years. So please think about what you're doing in your real life, how you can spread the word that this can be done today for every child, every time, everywhere. I'm around all day. Please feel free to join me at the lunch meeting. We can talk about this, and you can think about what you personally might be able to contribute to spreading the word, to supporting this, that this is happening now and not 50 years from now. With that, I'd like to thank you for listening. And make me proud.